Welcome to Real Clear Radio Hour, brought to you by the Competitive Enterprise Institute. I'm your host, Bill Frezza. This week, we mix tragedy and comedy with a look at two extreme ends of American business culture. In the second half of our show, specialty finance attorney and raconteur Bob Zadek takes us on a backstage tour of the Greek diner business. Up first, Pioneer Institute Senior Fellow on Healthcare Policy Joshua Archambault examines the botched launch of the Massachusetts Obamacare exchange and its lingering effects on the state. Josh, welcome to the show.
Thanks so much for having me.
Josh, you've been deconstructing the colossal failure of the Massachusetts Affordable Care Act Insurance Exchange, otherwise known as the Obamacare website, since it launched back in October of 2013. You put the price tag for this failure at $1 billion and climbing. A number of third-party audits and whistleblower investigations have been launched, and we ask you on the program to put this all in context for us. First off, what was wrong with the reportedly successful Massachusetts Health Exchange that implemented the Romney Care program, which Obamacare was supposedly based on?
Yeah, I think, Bill, a lot of people look at the conventional wisdom and think that Romney Care was exactly like the ACA or Obamacare, and they expected very little change in Massachusetts. But the truth is actually that there were quite a few differences, some on the policy side, but also a lot on the technical and how things were going to run and the requirements on the connector or the exchange. So as a result, the folks that were at the connector at the time decided to scrap the entire Romney Care exchange, and there was no discussion about maintaining any infrastructure that was built for that.
A total forklift start over.
That's right, and the way they described it, some folks in leadership at the time said they wanted to build the Cadillac of a health exchange.
Wow.
So that was their goal. And so that discussion where many people now, looking back, say, well, why wasn't there a discussion about maintaining some of the website that worked before? That conversation never came up. There was federal dollars on the table. The federal government had said, how much money do you need? We'll pull out our checkbook. That was the conversation.
Well, this is the land of the big dig.
That's right. That's right. And so as a result, to be fair about what was the differences, the Romney Care website was actually quite simple. Individuals would go on, they would input their information, and that information would, in essence, on the back end of the website, behind what you would actually see on the website, would basically just spit out an application for that individual. The state then had a few months to verify the information that you put in.
Using traditional means.
Sure. Calling the Department of Revenue. Is your income what you say that it is? How many people live in your house? And it wasn't that robust of a check. Just, do we think that you qualify for a subsidy or not under Romney Care? The Obamacare website was a totally different story. From when you look at the actual language in Obamacare for what is required for a state-based exchange, it requires things like real-time eligibility checks with 5 federal databases. And just to give you a sense for how hard this is...
This is in the law, or this is in the follow-up regulations?
This is in the law. There are a number of requirements that are specific and that are required of these state-based exchanges. And to give you a sense for how complicated this actually is, there's at least one federal agency that I'm aware of that their databases are running off software from the 1970s.
Well, the IRS just got caught out with Windows XP, which is how they exploited it to find all these Social Security and IRS information for people.
So IT procurement maybe isn't the best done at the government level. We don't have as many great examples, and that's the story here. But this has been the challenge. They had to do a lot more as part of the ACA, but it's also a lot more complicated. So it is a fair question to ask why we didn't maintain some of the foundational software and hardware that we had for Romney Care, but that conversation never took place.
Well, who was in charge of all this? Who were the players?
So certainly at the time, Governor Deval Patrick was in the corner office here, very close to President Obama, childhood friends, knew each other. And he kind of bear-hugged the ACA when it was passed. He was one of the leading advocates.
Cheerleaders, yeah.
Sure, out speaking on Sunday morning programs. And there are a number of kind of bureaucrats down the row, whether it was Glenn Shore, who was the former executive director at the Connector, became the budget guy for the governor. And then other individuals, John Gruber, who sits on the advisory board for the Connector.
He made himself rather famous, didn't he?
Sure. And he was, actually, Governor Romney appointed him to the advisory board for the connector. So he's been involved for years and years in Massachusetts and was part of this discussion about how you reformulate under the ACA and how much money they would need and what exactly was going to be required.
And the main contractor was the notorious CGI.
That's right. So Massachusetts hired the same contractor that healthcare.gov, the federal government, did for their website. CGI was also involved in Vermont and Hawaii and a couple western states as well. It's one of these very, very large IT integration companies. They're based in Canada, and they came and went their way through the bidding process. And what was slightly unique in Massachusetts is the person or the agency that held the contract was actually the medical school. So University of Massachusetts Medical School received the first grant from the federal government to build a website, and the original thought was they would build a regional website for all of New England.
Because it was going to be the Cadillac and the model for the country.
That's right, and they, the private discussions at the time were, well, we'll save some money, we'll do it for all of New England, and then we'll give away that software to other states to do regional exchanges. The issue was that the people at UMass Medical School, they weren't IT people. They were professors or policy people who wrote great things about the challenges of setting up these exchanges and then proceeded to violate every one of those red flags.
So we got a real example of what happens when you actually put professors in charge of something.
Yeah, perhaps this is one of many case studies that we can look at. And so they started, and the issue was that no other New England state stepped forward saying they wanted to participate. Vermont said we want to do our own. Rhode Island said they wanted to do their own, and so as a result, the University of Massachusetts Medical School became the primary contractor with CGI, and they focused just on the Massachusetts Exchange. They pulled in the connector itself and the senior leadership there. They pulled in folks from the Medicaid department who are part of this, and also people from the state Health and Human Services department.
Well, I read your report, and it sounds like there were an army of officials and bureaucrats and government administrators on the program. How many actual software engineers were working on it?
So when we talked to whistleblowers who were contractors for the state, they worked on the state side, they said initially there were around 40 state employees at the University of Massachusetts Medical School who were working on this project full-time. On the CGI side, they had roughly 20 initially, and very early on, there was maybe 1 or 2 software developers, and that was one of the problems, was that even on the CGI side of this equation, they didn't have the right people there at the table, showing up to meetings, and so when they developed a contract between the state and CGI, one of the criticisms that we found and the internal auditors found was the contract wasn't sufficient. It only went through about what was required for about half the project. So as a result, they started this project behind.
They started writing code without a spec.
Correct.
This is like 101 of engineering. You don't do that.
It is. And so some of the whistleblowers, and one in particular who has vast experience working on very large, complex government IT projects, primarily down in D.C. before this, showed up on his first week and said, so what are we working on? Where are the tracks that we have here? And there were roughly 70 of them, and he was responsible for about 2/3 of those. He was horrified that there weren't actual plans for each of those 70 tracks. There had been no document put together, no comprehensive plan for how they were going to move forward to a fully functional ACA compliant. And this is October of 2012, so very early in the process. And so from almost the beginning, there behind the scenes was trouble.
What kind of interaction was there between the Massachusetts team and the federal people responsible for all this?
So it's unclear how much informal contact there was. We assume, and from anecdotal evidence, there were phone calls. There were they called them gate reviews, that the state had to step forward and say, here's exactly where we are. Here's how much of the website we've built. Here's how much we have left. Here's how it's working. And in theory, those were put there so that the federal government could stop the project halfway through or
say, hey,
three-quarters.
We need to fix, something needs to be changed.
You're not on track. So we have, in our report documents, a couple of those gate review presentations. We were able to get our hands on the PowerPoint. And they're usually from later in the project. But what we see is that what is presented to the federal government is in complete contradiction to what's in the internal audits. There appears to be an effort by state officials to lie to the federal government about how far they were.
So someone built a Potemkin village.
It's worse than that. So it's not only lying in a presentation, But there were things that they had to do from a technical standpoint, and one of them was a connectivity test. In essence, what we talked about of your website has to show that it can connect to federal databases and in a real-time manner check if somebody's eligible. Well, the website wasn't ready. So Massachusetts officials came to that test with open source software, with stuff they hadn't even built, stuff they weren't even intending to use when they went live in the end of 2013. They weren't the only state to do this. Oregon did this, but it's why the FBI is investigating in both of these states that they were misleading federal officials to keep federal funds flowing into the state.
Oh, it's a follow the money problem.
Correct. And so that was the issue that we found, and what the whistleblowers were so upset about was that they, in many cases, were the ones who stepped forward and said, you're cheating, you can't do this, and in one case, they were let go shortly after that test.
Well, we all know what happened when they turned this thing on in October of 2013. Did they do any testing before they turned it on?
So they were supposed to do a number of rounds of testing, and in these big IT projects, you're supposed to test as you go on individual components of it, but then you're also supposed to do something in essence of how would a consumer actually experience
end to end.
Never happened. So the testing that they did do at the very end was incomplete, and when they got the results back, failure rates were in the 90% range.
So failure rate is 90%. We're all set to go.
Yeah, and so the internal audits show that of the 70 areas that they thought they would have to have up and running, only 4 were thought to be ready, and when it all was said and done, only 2 ended up working.
So, Josh, it really sounded like a disaster that lots of people knew were coming. Who had the final authority to approve the launch?
So I think that is part of the problem that we have here, Bill, is that the governance structure was dysfunctional. You had senior leadership from at least 4 different agencies who were demanding things of CGI, and it was unclear who was going to make that final decision. And one of the unanswered questions that we have is how high this went up in the administration here in Massachusetts.
Well, what did Governor Patrick have to say right before and right after the launch?
So he was very optimistic. It appears from his comments, 41 days after the open enrollment started, he was asked by the press, do you have any concerns about the website? And he said, none at all.
So he was still pitching this thing even as it was falling down.
That's right. And Gene Yang, who was the executive director at the time at The Connector, and Jonathan Gruber appeared on PBS's NewsHour on October 1st, 2013, saying this is going to be like using Kayak or using Expedia. It's going to be a great process. At least Gene Yang, we know, received memos, was in meetings, being told that this website will not work. And yet they all decided, let's go forward, let's open it. They were out doing a rodeo around Massachusetts saying how great this is going to be. You must sign up. They're spending millions of dollars on advertising. All the while, many of those in senior leadership knew the website wasn't going to work.
Well, is it against the law for bureaucrats to lie to the public?
Well, I think the unfortunate part of this was the human impact. So for individuals who didn't know whether they had insurance, for individuals that showed up to the doctor and didn't have proof of insurance, we had stories of people being turned away from the hospitals. We had doctors saying, well, I will see you, not knowing if they'll ever be paid. So there was a big health impact, not only stress and frustration, but there were a handful of stories of where individuals racked up $20,000 in medical debt thinking they were insured, and when they called their insurer, they said, we have no proof that you've actually gone through the connector to get
And this
insurance.
went on for months.
It did. In fact, it went on basically throughout all of 2014, where there were a lot of people who were in uncertainty, and the quote-unquote fix that the federal government struck with Massachusetts was to take 325,000 people and place them on Medicaid without checking their eligibility.
But that's got to be illegal.
Well, this is a big question. I'm not sure who would have standing to sue. But in this case, we know of individuals who are making $170,000 a year.
Who got put on Medicaid?
Who were placed on Medicaid, which has traditionally been a program for the low-income and disabled, pregnant women. It's not for people making $170,000. Now, at that same time, there were many folks here in the state saying, well, at least the Patrick administration figured out a stopgap. They put all of these people on Medicaid, saying how we've signed up more people than we've ever had signed up, all the while completely ignoring the cost to taxpayers, the fact that they're going to have to spend taxpayer money that can't go to the classroom, that can't go for cops,
Well, who
that can't
picked up
go
the
for
tab for this?
infrastructure.
Did the state or did the feds pick up the tab for this?
So we are still figuring that out to this day. There was an agreement set that based on who the people were that were actually placed on Medicaid, the state would pay different percentages and the federal government would pay different percentages.
Are they going to claw anything back from the guy who made $170,000 a year?
So it doesn't appear that they will. That has not been the agreement or the conversation. Interestingly, half of those 325,000 people haven't even bothered to show up this year to see if they're eligible for any public assistance. Leads you to believe that there were quite a few people there that maybe shouldn't have been there.
Now, did they get forcibly dumped into this program, or did they have to actively seek to get on Medicaid?
No, so these individuals, well, we have many examples of this. In some cases, they tried to use the website, didn't work, so they got dumped. But we actually have a staff member here at Pioneer who was put on Medicaid without any volition of his own, taking any action.
It just happened.
That's right. He received a note to his house saying, congratulations, you've been signed up for Medicaid. And his wife called the agency and said, my husband's not eligible. He has state health insurance due to a previous job. There's no way that he qualifies for this. We make too much money. And they said, oh, of course, we'll take that. We'll take care of that. He received another letter. It was a drug card for Medicaid saying, well, here's your drug card to be used. And once again, he called and said, I'm not eligible. Oh, yeah, of course, we'll take care of it. We'll take you off. And then at the end of the year, he receives one more letter saying, here's your tax proof that you've had Medicaid coverage for all 12 months of this last year.
So this was really a runaway train.
It was, and I think the real, again, travesty here for taxpayers is that the program he was enrolled in is something called managed care, which means the state sends a check to the insurance company every month, whether he receives care or not. So even though he never showed up...
So the insurance company's not going to complain. They're
of course
perfectly happy to be on the dole.
That's right. So they took this money, and unfortunately, taxpayers are paying the price.
So when Deval Patrick found out about this fiasco, who did he hold accountable?
Nobody at the time. I mean, what he did was say, we can't point fingers, we've got to address the problem. So he brought in a Blue Cross Blue Shield executive, Sarah Island, to be the point person, and she was responsible for figuring out the path forward. So the end result of that was they ended up paying CGI roughly $50 million to get out of the contract.
They paid CGI money? The people who screwed them?
That's right. There was a belief that CGI somehow owned the code, and so they were going to need to purchase access to that code, which is ludicrous from the standpoint that taxpayers were paying for that to begin with. That never should have been the understanding that CGI owned the code. Regardless, they dump CGI after paying them. Then they issue a no-bid contract for a company called Optum, and they bring Optum on board to try to fix the problem. Optum spends a handful of weeks looking at it and says, we can't deal with any of this CGI code. We're going to have to start from scratch.
Yet again. So they sign this large contract. They bring another company called Hcentive, who turns out Optum owns a piece of, oddly enough. And so these two companies come in and they kind of patchwork together a system. They had been working on the healthcare.gov website. They'd been working in a handful of other states. And they put together a website for open enrollment in 2014, which, granted, went much smoother than 2013. Big
but
success.
We have quite a low bar to exceed. And the website did struggle through, had lots of glitches, examples of people being on the phone for 18, 19, 20 hours and still not having any sort of assurance whether they have insurance or not.
Now, I understand that the U.S. Attorney's Office has subpoenaed documents from the Health Connector trying to determine whether any laws were in fact broken. What's the status of that investigation?
So I don't know, because like many of these cases, they don't actually confirm that they have an open investigation. It was confirmed by the press. The current governor, Charlie Baker, his office confirmed that they had received a subpoena for documents. I know that they have issued a subpoena to the Connector, and they've issued a subpoena to the University of Massachusetts Medical School, I assume to other agencies involved as well. They won't confirm or deny that there's a case, and they won't say what the case is actually about. So we're just going to have to wait and see where they end up on this.
Well, what are the politics of this whole thing? There's a new Republican governor, but obviously every governor wants to suck as much money as he can out of Washington, so he doesn't want to cut that gravy train off. And yet he'd sure, I would suspect, like to lay the blame on his predecessor from the other party. How do you see the politics playing out?
Well, Massachusetts may be slightly unique on this. Governor Baker has taken a very non-confrontational approach on when it comes to the health connector.
And he's from the industry.
Correct. He was a CEO for Harvard Pilgrim Healthcare for a number of years, so he's familiar with the complexities and issues that were playing out. I think whether it's the MBTA or other local issues that have exploded here in Massachusetts, his management style has been to less point fingers and instead point the finger to the future to say, how are we going to fix this? So he has appointed new senior leadership at the connector who have very, very deep IT backgrounds, and I think their goal is to just get the website functional this year. Even though we were told last year it was functional, there are still hundreds of glitches that have been identified, and they're trying to fill those gaps as quickly as possible.
So he's decided to be Mr. Fix-It rather than the new sheriff in town.
That's right. I do think, though, if the website does not run smoothly this year, there will be a very frank conversation about whether we still should have an exchange or not in Massachusetts.
And if Massachusetts decides not to have one, then what? They throw themselves onto the federal exchange?
That's right, and we have seen other states follow this same line. Hawaii most recently, Nevada, Oregon. They started down the road or set up there, spent a few $100 million in each of those states, and they ended up going with healthcare.gov as well.
So all the state systems that have crashed ended up falling into the arms of the feds. What lessons have we learned from all this?
I think in Massachusetts in particular, there's a number of lessons. The first one is that the state has a broken IT procurement system. We're not the only state, but there's been a number of very high-profile, very expensive systems, whether it was our judiciary system or our unemployment IT system, that has fallen apart. So something needs to change. We need to be much more transparent, and perhaps government shouldn't always be in the lead when it comes to procuring these services. Maybe they should release data and have vendors come to them and say, what value can you add? Then we'll decide if we want to purchase your services or not. So that's one lesson. The second one, though, is this mix of politics and federal dollars. When you have a political narrative around embracing a political agenda for federal policy, there has to be a local discussion about whether it's good for the state or not. That never happened here. In fact, people have been surprised over and over again by the ACA as it's been implemented to say, oh yeah, the medical device tax, that'll disproportionately hit Massachusetts companies.
Especially Massachusetts.
Sure, and there's a number of cases like those. The Cadillac tax is the next one that's coming down the pike that was supposed to be targeted at Wall Street, generous health insurance, but in reality will end up hitting unions, municipal workers, teachers. Probably 50 to 60% initially of Massachusetts citizens will be subject to the Cadillac tax when it kicks in. That's a real problem.
But which politicians were supposed to be looking after Massachusetts' interests rather than towing the Washington line?
Well, we'd like to think our governor and our legislators would be, certainly our congressional representatives, and I think the one person that probably out in Massachusetts deserves a little bit of credit for raising some concerns was Steve Lynch. Congressman Steve Lynch did express and gave a couple speeches at the time why he objected to Obamacare when it was going through the process. He did end up voting for it, but at least he took that charge seriously to step forward and say, how will this impact us? Now, he objected for some reasons that I wouldn't agree with, but at least he stood up and tried to start that conversation, and we paid the price for that. We are not only are our private employers paying more for their insurance now, but our union and teachers and others will be impacted adversely by this over time.
Well, it looks like another black mark for central planning, but that can't come as a big surprise to you.
Well, I think the issue here is that we don't have discussions about it. We don't have informed, data-driven discussions about what will be the unintended consequences of this. We seem to glom on to whatever the idea of the day is, believing, even here locally, believing that Romney Care was exactly the same as Obamacare when there were glaring differences that we should have been aware of, and our representatives should have been fighting to change the law or exempt us or give us a waiver so that we could deal with our own issues at the state level.
Well, Josh, this is a very complex political and technical subject. Thanks for coming on the show to help us figure it out.
Thanks so much.
That was Joshua Archambault, Senior Fellow on Healthcare Policy at the Pioneer Institute, here on Real Clear Radio Hour, brought to you by the Competitive Enterprise Institute. I'm your host, Bill Frezza. Please check out Real Clear Radio on Facebook or follow us on Twitter at Real Clear Frezza. And stop by RealClearMarkets.com, my go-to place for diverse views on political economics. Real Clear Radio Hour is a not-for-profit, donor-supported program. Please stop by RealClearRadio.org and hit the donate button or contact us to become a corporate supporter. Ahead, renowned specialty finance attorney Bob Zadek, host of The Bob Zadek Show, takes us on a hilarious tour of that venerable Northeast institution known as the Greek Diner. Stay tuned.